It says, hello, I am hoping this goes to Dr. Morse's questions that he gets on YouTube to answer. It did. I am a 24-year-old female, 5'2" in height. Whoa! So we know immediately she's at 5'2". We know pituitary right off, because the Homo sapien is probably in the feminine side, 5'7", 5'8", maybe, and Homo sapien lower. You start getting into the 5'6", the 5'5", the 5'4". I start to see a little pituitary involvement for 5'2" for sure. My sister's only 5'1", maybe the most. And definitely pituitary involvement. And I have mild scoliosis. See, so what we're looking at here is a pituitary issue that is now sitting down on her parathyroid gland, if not a parathyroid weakness on top of that weakness. It can be either way. You could have a parathyroid weakness genetically, or that area on the bowel wall be weakened in that area, or again, pituitary down, then shutting down PTH, which is the parathyroid hormone that is needed for calcium utilization. At the same time, though, remember this, is that when you're getting scoliosis or you're seeing any type of mutation of connective tissue or skeletal tissue, that acidosis always is present, because that's what removes the calcium and structure, the matrix. It affects matrix, and then, of course, it can blow back on the cell itself. So that's the problem. And of course, out of matrix is where the body can steal calcium to fight acidosis. And indeed it does. So this is why you see the bone spurs on the spine and everywhere else, of course, and stuff like this. So for sure, you want to move lymph. You want to get into that kidneys and adrenals. And of course, that when you're looking at this, what brought down the pituitary? And again, you're going back to the GI tract. So you have to have a little bit of a chronic transverse colon to have a pituitary down. So again, you can pull your eyes there, sweetheart, and take a look at that and see that connection there. A lot of times it'll also give you insomnia. It'll give you the pineal weakness with it. A lot of times when I'm doing eyes, I said I only see the pituitary. Here goes down the pineal with it, and they're not far apart. And filling the sinuses full of mucus is no help to any type of resurrection of that. So that's why sinuses have to be cleaned, and everything has to be moving to clean these interstitial spaces. So again, blood and lymph moves freely around the cells, collecting waste and feeding the cells. Simple stuff to think about. And scoliosis is, as you're seeing on this, many people have corrected their scoliosis on this site, and of course I do it in the clinic all the time. It's a beautiful thing to see. My question is, but if you don't, it's not beautiful. My question is, how do I strengthen out my spine? You don't have to, your body will do it. Quote, first, 100% raw. You're not talking about regeneration of the human body from some of these highly acidic degenerative states with just eating a few vegetables and some cooked foods and stuff. Not on your life. You're talking about taking your body into these high levels toward the formless. Energetically speaking, you're taking your body to the highest energetic levels this planet offers you in terms of consumable foods. Your fruit is the highest electrical energetic food on the planet. That and berries. So you can't get higher, but we are the highest species on the planet. If you want to use the word highest over, denoting duality, high and low. So of a species of a higher order and a higher consciousness requires higher foods, not your lower putrefactive protein type foods. It lowers your consciousness. It pulls you down. Which glandular do I need to take and how often and what dose? Okay, so what I would do is head off after the detox. I'm talking kidneys, adrenals, bowels. You're going after your lymphatic system, and you want to go after your bowels. I would say if you want to go fast, but I would give it about a month on this, and I do the first kit and deworm yourself. And about a month into this, I would add to my protocol the pituitary herbal formula, and I would add, hitchhike with that, I would add a parathyroid, 50 milligrams. That's the strength we've got, had them made for us. And I would probably, with a scoliosis case, I'd do 2 of those 3 times a day, and I'd hitchhike that with a bones formula or a superfood 2, which is extremely high in calcium. And I would hitchhike those that way, and then I would just stay raw and move myself up to the fruit side and still keep detoxing, and don't worry about it. And you'll see your spine pull itself. So you'll wake up one day surprised. I'm serious. I don't think we've ever failed with the case of scoliosis, to be honest with you. If anyone's out there having a hard struggle with that, stay 100% raw, dig into the lymph, because your lymph is influencing the muscle pull. And then, of course, you've got your weakened structure and bone matrix. So you're after all these sort of things, and you don't have to think about that, to tell you the truth. You just have to fix your body's digestion, absorption, utilization, and elimination. Remember the 4 processes that are essential to being in Wellville. I also have fibromyalgia and depression. So the depression, sweetheart, is linked to the parathyroid. So you're lucky there. You can fix that depression right off. That's the parathyroid gland. When you're not utilizing calcium, guys, that's depression. And that's parathyroid gland. Easily fixable. Depression is easily fixable. You might also want to get the fungus out of the body, a very contributor to depression. Now, fibromyalgia. Basically, you have systemic, what? Stagnation of the lymphatic system. That's how you get inflammation head to toe. You're systemically inflamed. You're systemically acidic. Now, I had scoliosis from age 5. Okay, so right here, let's stop right here, guys. We got tonsillitis all the time. Now, we've got scoliosis, so we know there's something in this area that affects the skeletal system, isn't there? What's in the throat area affects the skeletal system. Right on. I tell you, I've met with a lot of you guys. Man, are you getting this? I'm telling you, you guys know things no one else does. Yes, parathyroid gland, not utilizing calcium properly, and of course with the tonsillitis, you know, sweetheart, your lymph was backed up, and so now your back's pulling to the stronger side. Scoliosis, more than 75 degrees, can be treated if a surgery was done and totally helpless. What created scoliosis? We've talked about this before. And scoliosis, of course, and you can also see connective tissue problems and things like this. In an acid medium, you're going to lose calcium. There's no question. You're going to see the 2 antacids, and I'm going to do a video on these 2 antacids, calcium and cholesterol. And, of course, the body has to protect itself against acids, which are cellular wastes. And of course maybe some parasitic waste there too. So the body builds up a lot of acids, so the lymph system has to deal with this. And of course that's why it's a thicker lipid-based fluid. And when you're not moving lymph well, depending which kidney's weaker, that side of the back gets stiff or tight or more, then you start seeing the pulling out by the muscles. You see the spine being pulled one direction to the other. Generally to the strongest muscle will win, and you'll see the spine curving or pulling to that side. And again, parathyroid, but I'm not surprised if this is the same person, then we've got a lot going on in the head area, and we've got the parathyroid here. Pituitary controls parathyroid, so this could definitely right back to the pituitary again if this is the same case with vitiligo. So you would have to assume that the pituitary is suppressing the parathyroid unless you had the eyes. And if you had the eyes, you could determine if there was a parathyroid weakness on top of the pituitary weakness that exists. So you would go after those with glandulars for sure. But you want to move those lymphs. I mean, this is the case where you got a lot going on in the head area, very dangerous. To have a scoliosis, you would have to have kidney problems to begin with, because remember, the lymph runs up the back like everywhere else. It runs everywhere, and when in an acid medium, your body not only is going to lose the calcium, but one kidney is going to filter always better than another. Very rarely do you see bilateral kidneys that are the same in their health. You always seem to see one kidney weaker than the other, which makes one side of the back more tight than the other side of the back. And you'll see that pulling of the spine out. Particularly in a weakened state with the parathyroid. So I would really pop on the parathyroid. Some person asked me about the parathyroid here. Outside of a parathyroid glandular, I assume that the only parathyroid herbs are really going to be the berries again, because the berries seem to be the endocrine gland herbs. Same thing with fingers, same things with feet. The body, excuse me, will realign itself. But it takes a good year of 100% raw. Don't kid yourself. There's a big deal going 100% raw. I mean, just test this for yourself. Do 1 month 100% raw, and then just add 1 cooked meal a day in there and see the difference. Just 1 cooked meal a day and see the difference of where you were and where you are now.